Dr. Rajesh Bathani, Consultant Medical Gastroenterologist, Aster Ramesh Hospitals. Today I am going to talk about a rare condition called Achalasia and a unique endoscopic surgery done for the same. A 62-year-old gentleman referred to us with complaints of difficulty in swallowing and regurgitation of food back into the throat for last few years, associated with chest pain and weight loss. Here we have evaluated with endoscopy, which showed dilated esophagus with food residue and tertiary contractions with tight G junction. As per standard investigation protocol, esophageal high resolution manometry was done, which showed type 1 achalasia. Achalasia is a rare esophageal motility disorder, and the symptoms of the same are difficulty in swallowing and regurgitation of food. That is, the food keeps coming back into the throat as the patient lies down. These can be very debilitating symptoms. Associated with the above symptoms, patient can have weight loss and chest pain. It occurs because of neuronal, that is nerve loss of the esophagus, maybe due to viral infections and genetic predisposition. It affects around 6 to 10 individuals per 1 lakh population. Endoscopic procedure called peroral endoscopic myotomy, also known as OM procedure, is being done worldwide for achalasia. It has become standard of care in the treatment of achalasia. After discussing with patient attenders regarding risk and benefits and also taking written informed consent, the patient was taken up for POEM procedure. In POEM procedure, the initial steps are submucosal injection and creating a sufficient mucosal bleb. But in this case, I have encountered a problem where I am not getting a sufficient mucosal bleb. After a failed attempt at another place, I had two options, whether to abandon the procedure or to go ahead with the peroral endoscopic myotomy, but in a different way. After discussing with the patient attenders, patients asked me to go ahead with the procedure. And I have done a unique kind of peroral endoscopic myotomy called Open Peroral Endoscopic Myotomy. In this procedure, the long mucosal incision is done, and it is done for around 10 centimeters above G junction, till G junction and beyond G junction for 2 to 3 centimeters. And after long mucosal incision, circular muscles of the esophagus are also cut along the mucosal incision till G junction and beyond G junction for around 2 to 3 centimeters. And after the procedure, G junction is relaxed, and during the post procedure, patient had uneventful recovery. At discharge after 5 days, patient was tolerating liquid diet without dysphagia and regurgitation of food and liquid. After 15 days, when patient came back for review, patient was tolerating soft diet without any dysphagia or regurgitation. And endoscopy was done after 1 month, which showed complete healing of the long mucosal incision, and there is complete relaxation of the G junction. In open peroral endoscopic myotomy, we don't close the mucosal incision unlike in conventional POEM. I think, to my knowledge, open peroral endoscopic myotomy is a procedure of its kind done first time in India, and this is especially useful when conventional POEM is technically not feasible due to severe submucosal fibrosis. Thank you.